Well, good morning, everyone. Welcome back, especially to the Hale and Hardy who have actually come here. And I know there are many of you on the webcast as well, and thank you for participating. A number of you actually have emailed me with some comments and questions from having watched it from home, so we're really appreciative of those, and from the office. So welcome to day 2 of Telehealth in an Evolving Healthcare Environment. Thank you so much to our HRSA sponsors, and thank you to the IOM for helping us to put together this workshop. I also want to express my gratitude to our planning committee members, Tom Nesbitt, Nina Antonetti, Kamal Jethwani, Spiro Manson, and Sherilyn Pruitt. We couldn't have done it without all of our collaborative efforts. So this morning, I briefly want to recap what we did yesterday and then advance us on to another exciting day of discussion. The focus of this event is really to put in the record where we think we need to be with telehealth as it's integrated into mainstream healthcare, which it is in many environments, but could be more broadly integrated. So yesterday we had a wonderful passionate presentation by Mary Wakefield, sharing with us all the various roles of HRSA in advancing access to health care, mitigating many of the disparities that patients face both in rural and urban settings. We had an inspirational talk by Tom Nesbitt, who's challenged us to continue to promote the evidence and advance telehealth into mainstream. We had a panel on the challenges towards the very issues that we're talking about, a panel on payment models and innovation, moving forward from CMMI's perspective, and we had folks speaking, not just passionate pro-telehealth, but folks who actually presented the contrary versions of what where we haven't proven value and where we need to go to prove that. We just had great discussions on the healthcare continuum, and today we promise to be equally exciting and challenging. So this morning, I want to introduce Kamal Jethwani, who's going to open with our first panel, and that panel is going to talk about the current evidence base and how we integrate that evidence into advancing public policy. Kamal.